Now, the second wave of COVID-19 is just not letting up. The death rate has doubled in some provinces, but Gauteng government says it has a plan to deal with the spread. 4 regions have been declared hotspots in Gauteng. The Premier's spokesperson, Vuyo Mhaga, joins us now via Zoom to talk about the contingency plans to deal with the influx of people returning from different parts of the country. Vuyo, many thanks for your time this evening, and a very important part of this conversation will be that fact that people will be returning in the coming days, and that's going to risk more people getting infected. And what is the government's plan, the immediate plan, to deal with what we're going to be seeing in the coming days?
Well, thank you very much for having us. Actually, that has always been the Gauteng plan, that a lot of people obviously will be coming from different provinces back to work in Gauteng. So we have actually placed a number of contingency measures in place. For example, the police are hard at work. So we'll have what we'll call your roadblocks in all entrances of Gauteng, and what we'll call, rapid testing and screening. So that work will be done. So it's a combination of both the security cluster as well as the health department working in collaboration to make sure that we minimize the number of people who are positive entering Gauteng, and we're able to make sure that they are isolated, they are quarantined. Those who need hospitalization will be done. But also another plan is to make sure that we continue working with the malls, because you'll know that people continue going to the malls, to make sure that we're working together. So there's another stream within the Gauteng government that is actually looking at businesses, engaging with businesses, and closing some of the businesses that are really not complying.
One of the big concerns here is the health element of the Gauteng government's plan and the state of readiness. We do know that healthcare workers are overworked. Many of them are getting sick with COVID-19, many of them passing away. Surely government has to have a very strong plan to ensure that it's ready to take in those new positive cases that may be severe because of the new variant.
No, indeed. You'll remember Gauteng had taken a different approach compared to most of the provinces, that we needed to increase the existing infrastructure. So we've been doing that ever since the COVID actually came in. So the plans that we had, that were supposed to be 5-year plans, were brought forward. So there are a number of beds that we have actually increased the capacity. So if you go to the N1 that is normally used between Gauteng and Limpopo, majority of accidents happen there. So you've got a lot of trauma that is happening there. So the Jubilee Hospital, which normally caters those people, have been increased by 200 beds in terms of the healthcare. Or in terms of the high care. So you've got those beds that are available. If you go to Bara, those beds are available. If you go to Gold Ashanti, we are actually almost in the closure. So we're quite comfortable and confident that as we deal with this schedule, a lot of people will be demanding to have beds in Gauteng hospitals. We will be able to respond that positively. But we are continuing to make sure that also the human personnel is actually increased. So instead of building only what we'll call the field hospital, we want to build a health infrastructure that must actually serve people of Gauteng even beyond COVID. That was basically our strategy that we've been dealing with.
Mr. Mhaga, what about spending oversight? I've just spoken to the DA, and they're concerned about monies being spent incorrectly. They gave an example of the Anglo Gold Ashanti Hospital that was given or handed over to the provincial government, and 500 million has been spent on that, but it has not been completed, and it's not being used to full capacity. How confident are you that you're not going to be seeing any leaks that could jeopardize the provincial government's efforts?
No. In terms of that, it's just very few minor issues around the Gold Ashanti. So I think in a few weeks, as people actually coming back, we're quite confident that will be fine. In terms of the spending, obviously we'll spend within the means, and if there's really any wrongdoing, you'll know Gauteng has always been quite clear that anyone who has done something wrong will obviously face the music. Where we are, everything must be justifiable, and also appreciating the period and the time that we find ourselves in.
Right. How is the provincial government doing in terms of oversight on restaurants and other establishments that are allowed to operate, and just ensuring that they do not go over the curfew? Because you've mentioned that a lot of the police force will be out on our national highways ushering in people coming back into the province.
Well, as I've said, there are two streams. So you've got the law enforcement that, as you are correctly saying, are actually looking at people are coming through. There's another stream, what we'll call, the business stream within the Gauteng government, working together with the malls, working together with the restaurants, and closing some of them who are actually not responding positively to the message that was delivered by the president. So we've got different streams that are making sure that we are responding. We are continuously meeting with business owners within Gauteng, as well as I've said, with the mall owners, to make sure that we work together. And we have also distributed the numbers of both the law personnel and will be distributing the numbers of the business unit. So even South Africans and ordinary Gauteng citizens, whenever they feel and find that a particular business unit is not responding, they are able to call those numbers, and we're able to make sure that we dispatch the law enforcement agencies to make sure that they curtail those businesses.
Thank you very much for your insights this evening. That was Gauteng Premier spokesperson Vuyo Mhaga.